order to indicate that the governor of Wajir was crying because of having failed to do what he was supposed to do on the hospital and health infrastructure. While in actual fact, he indicated he was having tears of joy to see the celebration of Madaraka having recognized a county that was treated as an outlier county or marginalized or peripheral county. And he acknowledged that now the president had brought that county to the mainstream and considered it good enough to host the Madaraka celebration, a historic event which has never happened in Wajir County, Honorable Speaker, and which I had the honor to attend and would have also loved to see you there, Honorable Speaker, though you had other engagements, maybe in Meru County. Is that, Honorable Senator, in order to indicate that the governor cried for different reasons than what he enunciated on that day?
So can you verify now your facts?
No, Mr. Speaker, I thought Senator Veronica wanted us to know that she attended the Madaraka celebrations, and we're happy she did that. If she wants information about the performance of Wajir, the report has been tabled by the Health Committee, and Senator Omar is seated to her. She can share with the report, and I'm willing.
You know the issue is you arranged that the governor for Wajir County.
Yes.
Tears.
I said the governor was emotional. I didn't say he's shedding tears.
So that is the point of order from Senator Veronica.
I said, Mr. Speaker, if the answer can bear me out, I said he became emotional. I didn't say he shed tears.
Actually,
so I don't know
said
where.
He was not emotional, but
yes.
The answer is very clear, and I was really keen listening to you. I thought there will be a member who might raise a point of order on your statements.
Mr. Speaker, I think the issue is very simple.
How can you prove about the emotional issue? How can you prove now to this floor, to this House?
Mr. Speaker, I have, and I will table, and it is part of the documents, on the report by the Health Committee of this House that tabled the report on the status of health. It was not the report which was being discussed in Wajir. It was celebrations for Madaraka Day celebrations. So how can you table now a report on the county? Mr. Speaker, if it will ease the House...
Can you kindly withdraw that
yes, he was shedding tears. He didn't shed tears, but I say he became emotional. So that is the point, Mr. Speaker. So, Mr. Speaker, on Kiambu...
Can we withdraw that part about the non-performance? Please, you have to do that.
Which one?
You know when you arrange some issues that you can't really substantiate, and this governor...
So I withdraw the part of shedding tears,
cannot be able to come to this floor to defend himself.
So, Mr. Speaker, I withdraw the part shedding tears, but the fact remains that there was a report on Health Committee that indicted, and I wish Senator Omar, and it is part of the documents. So I have withdrawn the part of shedding tears. So I proceed, and there was a report that was tabled on even, and I seconded that report, and it is part of documents.
Information from Senator Mariam?
No, I thought that report is before the House. Can I proceed?
Are you ready to be informed?
Maybe Senator Omar can inform me because she is the owner of the report on health.
Senator.
Thank you, Mr. Speaker. Mr. Speaker, I wanted to inform the Senator that what he is contributing is two different things. This is Madaraka Day, and the other one is about the report we have tabled in the Senate. Yes, the report has so many discrepancies. Nothing has been done, but it is there. But when it comes to emotional issue, Mr. Speaker, it is about the northern Kenya, which President has recognized in Madaraka Day. So let the Senator to withdraw on the issue of emotional on what has not been done by the governor. It's only that. If he withdraw that one, the report is the way it is. The recommendation is there. Thank you.
he didn't withdraw about the shedding of tears, and he has withdrawn that bit.
Mr. Speaker.
So can you really discuss the report without censures?
No, Mr. Speaker, we were discussing, I heard my colleagues had mentioned the issue of health across the country, and they were tying him to the report, so I don't know why. I even heard a senator here speaking about Ebola, which is not part of the report. Mr. Speaker, anyway, let me proceed, but I will restrain myself to the Kiambu, Karuri, Kiambu, Ruaka. Mr. Speaker, Kiambu, in as much as there were some issues, we realized that their maternity are overcrowded and missing mosquito nets. So if you have us discussing, Mr. Speaker, the ODM party leader is in the house today, Senator Oburu Odinga. If you have us discussing about non-availability of mosquito nets in maternity ward in Kiambu and Karuri and also Ruaka hospitals, it's very unfortunate. And even overcrowded maternity. In fact, this committee were denied data of mortality to the hospitals, Mr. Speaker, which is very unfortunate, Mr. Speaker. Even the dilapidated infrastructure. And, Mr. Speaker, in Kiambu, people are operating in a funny way. You can just walk into a Kiambu hospital and walk because there is no identification documents. The nurses there, the staff are not wearing badges, Mr. Speaker, which is very unfortunate, Mr. Speaker. And even the issue of mortuary, we agree, and I agree with my colleagues, that the issue of mortuary, Mr. Speaker, we must agree that there is a problem. We don't want Kenyans to have international departures to heaven. But we must agree that the issue of mortuary is still a problem. All over counties, even in Nandi, I have only one functional mortuary in Nandi Sub-County Hospital, but we don't have in other. And there are many dilapidated, even here in Kenyatta National Hospital. So, Mr. Speaker, I want to appeal to the committee that after they done visits, because they have done Nandi, they did Elgeyo Marakwet, they have done others, Mr. Speaker, we must also visit referral hospital, Mr. Speaker. You know, referral hospital are suffering because of overcrowding by counties. Like Eldoret, Moi Teaching and Referral Hospital, I want to appeal to the health committee, if it is not too much, through the vice chair, to visit Moi Teaching and Referral Hospital of Eldoret because it's slowly collapsing, Kenyatta National Hospital, Mbagathi, Mr. Speaker, so that we can ensure that as a county, we move forward as a country, Mr. Speaker. Finally, Mr. Speaker, on this issue of stall projects, health projects, as I conclude, when you look at counties, I think like in Nandi, Mother and Baby, you have seen most of them, Mr. Speaker, across. And I'm happy that Senator Omar-led committee has noted this issue of infrastructural problems, Mr. Speaker. Because even in my county, the governor has been doing Mother and Baby for the last 10 years, and yet it's not complete. You go to many counties, and I'm happy this report has talked about infrastructure delay, even in Bungoma, even in Kakamega, Kiambu, Makueni, and Kitui, Mr. Speaker, and even Meru, Mr. Speaker. There are some of the dilapidated infrastructure. Like, for example, in Wazingishu, they have stalled projects worth 2.4 billion, which is the highest in the country, Mr. Speaker. And these stalled projects, they have paid 1.0 billion. Yet all of them are stalled, like when you go to Siwa Level 4 Hospital, when you go to Tarbo Sub-County Hospital, when you go to Keses, all of them are stalled, yet 1 billion has been paid. And you find yourself funny in most of these counties. Mr. Speaker, they are doing a snack park worth 5 million. And they have used 4.8 million for a snack park. Yet there are no drugs in hospital. For example, in Wazingishu, they have a snack park that have paid 4.8 million and 5 million. You know, in my culture, if you do around with sex, we are worried what you want to do with the snakes, Mr. Speaker. Because it is not like India where snakes are being used for sports. Snakes are used for other things, Mr. Speaker. So we must, and even they are doing, I'm wondering, they are doing a museum worth 25 million in Wazingishu. Yet they are not completing those toll projects. Even in Nandi, Mr. Speaker, can you believe in Nandi dispensaries are closed between Saturday, Sunday, and they open dispensaries between 8 a.m. and 5 p.m. I don't know whether sickness has a way of coming. So I don't know, can sickness not come after 5? This is a problem that we must face as counties. Finally, I want to challenge counties on the issue of Ebola preparedness. We want to hear counties discussing what are they doing to prepare the issue of Ebola preparedness. And I've had my colleagues, Mr. Speaker, we have to accept there are Kenyans working in DRC. This is not a corridor where our drivers drive all the way to DRC. Our colleagues who are opposing Ebola preparation by the country, telling us that Kenyans who are in DRC or drivers, they should be locked out. And Mr. Speaker, what people are not telling, and I'm happy the President said in Wajir, what people are not saying, the biosecurity agreement was signed in 2015 by former President Uhuru Kenyatta. When 640 a plane from China landed here during COVID crisis, no one went to demonstrations because it was Uhuru Kenyatta. But when President William Ruto prepares facilities to fight COVID, not Ebola, which 15 cases have been reported in Uganda, the demonstrations are being done. And we don't know to blame our school children when they burn down their dormitories because they have seen what their parents are doing in the streets. They are burning houses, they are looting, Mr. Speaker. So we must be ready as a country, and I want to encourage the President, the government, led by the CS Aden Duale, that we must be ready, prepared for Ebola preparedness, Mr. Speaker. It is the obligation of government to ensure that we have necessary facilities to prevent Ebola in this country. Mr. Speaker, with those many remarks, I beg to support this report.
Senator Veronica Wahetian, after you are done, you approach the chair for some more guidance.
Thank you, Honorable Speaker, for this opportunity to comment on the report that has been brought to this House by the Health Committee. Let me first commend the committee for the good work they have done. Honorable Speaker, they carried out the mandate that they were supposed to carry out, and I would say this is how oversight is supposed to be done. Oversight of functions that are devolved must be followed up by the relevant committees to see whether they are actually implementing what is expected, that counties are implementing what is expected. So the committee has gone out there to the different hospitals from Kitui, from Makueni, from Kiambu, and a few other counties, Machakos also, and they have assessed the state and the quality of the infrastructure, facilities, hospital equipment, and even provision of emergency services. They have assessed the automation of healthcare provision systems for patients, drugs, and commodity management. They have assessed the availability of requisite healthcare personnel, the gaps and challenges in the counties that are cited in the report, and they have also assessed the availability of training and capacity building programs and avenues for healthcare workers in emergency healthcare, specialized services, and referrals. Honorable Speaker, the shocking thing is that the report they have returned here is not something we did not really expect, because we do know that our healthcare has still not yet achieved the standard and the quality that it should have achieved by now. But shockingly, Honorable Speaker, is to see that the same problems we may have discussed in year one when we were in Senate are the same problems in those hospitals that we are discussing today, which is year 4, just before the tenure of this Senate comes to an end. And we ask ourselves, Honorable Speaker, in the mapping of the healthcare, the scope of healthcare services, and the standards that are supposed to be rendered by the healthcare services in our respective counties, what is going wrong? And what exactly do governors think about the right to healthcare, the right to health for the citizens of Kenya? I think, Honorable Speaker, to be fair, national government has done a lot, even rolled out the universal health coverage program, Honorable Speaker, that intends to ensure that citizens have access to health services, have access to health care, have access to medications, Honorable Speaker. But unfortunately, the counties are not holding to the end of the bargain. I have especially looked at the report that was returned against Kitui County, which has a population of about 1,136,187 people. If you look at what's happening in Kitui County, Honorable Speaker, it is pathetic to see that even the TB patients are being boxed within a cube inside an ordinary ward. Now, who does that, Honorable Speaker? This country is the one that is even giving medical personnel to other countries within the region. Even a lay person knows you cannot put a TB patient who is at a very infectious stage next to other patients. It's no wonder, Honorable Speaker, that you'll find the way counties are running these hospitals is in a very, how would I say it, lackluster manner, kienyeji, if I was to use Kiswahili. I have even looked at the Reno unit in Kitui. You should look at these photographs that are attached to this report, Honorable Speaker. It is a big shame if a county cannot even clean up an area and it's within a hospital setting, Honorable Speaker. And I think, Kitui County, just wake up. You want to tell us that even if you had the facility and the drugs, you are not able to manage your personnel to clean up areas within a hospital setting, even housekeeping, to avoid infections being passed. Honorable Speaker, we are very much aware that in hospitals, there is always a possibility of catching one of the worst bugs because of hygiene, just basic hygiene. So, Honorable Speaker, it looks as though counties have still not taken healthcare with the seriousness that this healthcare deserves. And I want to say this, while as the Senate has done well to oversight, and that committee needs to visit the 47 counties, and health committee, led by their chair, Senator Madago, and deputized by the very able Senator Mariam Omar, a member of Kenya Women Senators, who is doing a very good job. Honorable Speaker, they need to go to other counties and assess periodically, maybe even every 6 months, to check what is happening. And I welcome them to Murang'a, because just the other day, on 20th May, Honorable Speaker, a resident of Murang'a reached out to me. She was expectant and she had an emergency. She was going to give birth in the hospital. And when she got there, 4 days, Honorable Speaker, she was not attended to. I do not know her personally. She sent a message to me, crying if she could be helped. And within the course of those 4 days, I do not know where the doctors were, where the personnel was, where the records people were, where the emergency section was, what the maternity wing was doing. On the 4th day, unfortunately, the baby died in her stomach, Honorable Speaker. And she still was not attended. So she called for help, saying, now help me to get discharged from this hospital so that I can find help. It is very wrong, Honorable Speaker, that women who are expectant, 4 women, 5 women are sharing a bed with their babies there, with their infants, who are very fragile and very sensitive to any kind of infections, Honorable Speaker. And then we bundle those mothers together. If one child is ill, maybe the infection will be caught by the other children, the other infants who are sharing the bed. Can we say on a bare minimum, there is a level we are not supposed to fall below? Can the counties dignify the mothers, expectant mothers? Counties, we ask you governors. We know we only have 6 women governors who may have gone through maternity and labor ward. But can we, on behalf of all the mothers in the Republic of Kenya, ask the counties to ensure mothers, when they are delivering, are not sharing beds? It's a very sensitive moment, and that's why you see infant mortality, maternal mortality is a question that is discussed the world over, and data is retained to show whether we are doing better or we are doing worse. Because a mother being expectant is not a death sentence, Honorable Speaker. And if it's a death sentence today, it will be a big shame to our universities that are churning out doctors within the Republic of Kenya and even training doctors for other countries that are around Kenya, neighboring Kenya. Honorable Speaker, we also need to remind the counties that they need to enable their doctors and the personnel to be able to carry out their duties with ease. And I want to make a proposition today, Honorable Speaker. Some of this money you are seeing, these billions that are allocated to counties, I am happy with Governor Ann Waiguru. She has dedicated about 68% of her budget. I heard that when we went for the launch of Enewe. Is it called Enewe? Every mother, every newborn program, Honorable Speaker, that she has dedicated around 68% of her budget to medical care and health care facilities. Honorable Speaker, I want to request the governors, Could we dignify the mothers who are expectant? Can we dignify them and allow them to at least have a bed and have access to medical personnel that is able to help them promptly so that we do not have women dying today in Kenya while giving birth, Honorable Speaker? And the infants also, Honorable Speaker. You remember there was a time Kiambu County was cited on media that so many infants had lost their lives there. And the county, though it denied those allegations, it also admitted to an extent that some had been lost. In this day and time, Governor, you must get interested. If one infant dies in your county, don't accept it as an ordinary thing. Let the reports be brought to the table to know why that infant was lost or why a mother was lost. Nothing is as painful, Honorable Speaker, as a day when I went for a funeral for a 24-year-old in my county who died while giving birth and left an infant who was 1 day old, Honorable Speaker. And I looked at her eulogy and asked myself, at 24, she bled to death because a hospital that purported that it should have been licensed pretended to be a healthcare institution, and yet they did not have capacity, allowed that young girl to bleed to death. Honorable Speaker, I want to ask the Council of Governors, can we wake up? Nobody should touch, in the name of corruption, a coin that is intended for healthcare within this republic, Honorable Speaker. If you do that, remember, you have done it against your very relatives who are within that county and who will one day or the other unable to access that health care, Honorable Speaker, and they will follow the channels that you would never want to follow, and yet you may not link it to them. But the fact is, if we have a level 3 hospital in one part of the county and your relative was unable, you relative of the governor was unable to access that health care, if they die out of that failure to access medication, Honorable Speaker, it means that you have failed your relatives, and even your relatives will follow the same path that the Kenyans are following, and God forbid. So I want to say this, because we have struggled a lot as a nation with the question of corruption, we need to check the procurement. And if KEMSA is the one that is supposed to refill the drugs in all these hospitals, because under every hospital here, we are seeing the capacity of KEMSA to refill drugs to hospitals is actually low. It's about 50 to 60%. There should be no reasons why procurement cannot be seamless for emergency, to assist with medical emergency, Honorable Speaker. And finally, Honorable Speaker, because I want to give a chance to other members to talk about the healthcare and the report that has been brought here, I want to commend the national government for the SHA program, and I want to ask any person, any Kenyan, especially kutoka Muranga, please don't come asking for medical bill support if you have not registered for SHA. Because what do you want us to do with you? If everybody brings a medical bill to Mheshimiwa, and yet you have refused to register for SHA, which could take care of about 30-40% of that bill. In fact, nowadays when I'm brought a bill to assist, the first question I ask the resident is, are you registered for SHA? Have you registered? And I believe it is star 147 star or maybe 147 hash. And I believe every Kenyan should be registered for SHA so that you can hold the county government accountable, you can hold the national government accountable to share in the bill that they are supposed to pay for you in the eventuality, the unlikely eventuality that you are admitted in or you are accessing medical care and health care within the public facilities. And finally, Honorable Speaker, over 95 or maybe 96% of Kenyans are only subject to be helped through the public healthcare facilities. So it's not a small issue, and governors need to take it very seriously. The allocation of funding that is supposed to go to improvement of facilities, Honorable Speaker, should go direct to the improvement of those equipments and facilities. Why do I say so? Because right now, the healthcare ecosystem has been allowed to receive money, to have an income directly from the county to ease the process of repairs, the process of maintenance of equipment in hospitals. And I'm shocked to see that there was an X-ray machine which was not working for 3 weeks in Kitui. Why would we not have basic equipment working or operational and serviceable to be able to serve the people? Honorable Speaker, with the advent of technology, we should be managing diseases, we should be managing infections, we should be having public health departments within the counties which are so strong that we can have preventive measures to avoid a situation where diseases get too serious until they require much more resources to be treated in high-level hospitals. And let me take this opportunity, Honorable Speaker, to congratulate Wajir County for the hospital that His Excellency President William Ruto opened, a level 5 teaching and referral hospital in Wajir County, which has opened that whole northern region of the country with 3 operating theaters, with an ICU, with a HDU, and a state-of-the-art emergency section, emergency center there, Honorable Speaker. And I believe with this hospital, the people from Wajir and the neighboring counties now have help closer to the people, and it's easier, it's cheaper, and they can get access. But that facility may not help if there is no follow-through with maintenance, follow-through with the medication being available, follow-through with dignity to patients like mothers who are delivering, being given the dignity that they require to have when they are delivering, and in their moment of pain, their moment of struggle as they bring forth newborns, Honorable Speaker, they require to be given that dignity. Women have suffered for so long, and it's time we have health care that is also gender sensitive and sensitive to the needs of the mothers, sensitive to the needs of patients who are having infectious diseases. And Honorable Speaker, let me also say that because we are advanced in how we are rolling out healthcare in Kenya, we must also accept that preparedness does not mean we are inviting disease. Can you imagine, Honorable Speaker, in 2019-2020, if the Ministry of Health did not take any measures to prepare for COVID, to contain COVID, we must have centers that contain disease, not to attract that we are asking for disease to be brought over to Kenya, but centers that contain that infection, so that in the event that anybody crosses into Kenya, even with Ebola, the doctors, we would expect the doctors and the Ministry of Health to have a center where they can manage and contain it and separate it from people who are not infected, to avoid fatalities because of public infectious diseases. And Honorable Speaker, maybe the Ministry of Health and Public Health need to be sharing information more to tell Kenyans that the U.S. Embassy has had a CDC center within the Republic of Kenya. And for the longest, I've always seen CDC people being employed by that center for disease control, which is within the Republic of Kenya. Maybe if that information is shared, then Kenyans will be more at ease. And if Kenyans are explained for what isolation means and what quarantine means, that when patients are quarantined, then they are not supposed to be in contact with the rest of the world. They are supposed to be contained until they recover, so that the disease does not spread in any way. Honorable Speaker, with those many remarks, I wish to support this report and request the Committee on Health to please come and assess our health care in Murang'a County, because there are some of those clinics which have just been painted nicely in blue and white, but there is no medication. Even if you queue there and you're given a prescription, you are told to go and do your examination. If it's an X-ray, you are being sent out. There is no medication. And even if you are given some medication, ni Panadol, ama paracetamol, we want to see healthcare that meets the needs of the people. And finally, Honorable Speaker, we must accept that even ourselves as Kenyans, we have accessed healthcare in India. We have accessed healthcare in South Africa. We have accessed healthcare even in Singapore. Kenyans have accessed healthcare, even in the US, in many other countries, Honorable Speaker. So maybe when a center is being done, we need to have a bigger, wider perspective that if the government kept quiet about Ebola and then a case happened, then what questions do they answer? What answers do they give to Kenyans if we cannot contain even one case of Ebola? It will spread to 10, to 20. It will do exactly what people are fearing. But I know right now, people must be very afraid. Everybody would be afraid of Ebola. I would be afraid of Ebola. I don't want to come into contact with it. But we must be realistic to know we must accept medical centers that take us to the next level and that are able to contain all the diseases. The reason why Kenyans go to India, the reason why Kenyans go to United States or the UK is to seek for more advanced technology and more advanced medical help. And if we do not have access to those countries, you need it. And when our nation does not have the facility that is required, then it becomes a very big difficult. We must think within that context because God has positioned Kenya as a nation of influence, as a nation that has also supported our neighboring countries in many, many other issues. Thank you, Honorable Speaker. And we must also remember we are trading with all our neighbors and the trade will not stop. We want life to continue, so let disease be contained within the centers that should contain disease. Thank you, Honorable Speaker.
Very well. Next is Senator Ososi. Godfrey.
Thank you, Mr. Speaker, for this opportunity. Mr. Speaker, I have read the report that was prepared by the Committee on Health for the counties they visited, oversighting the county referral hospitals. And Mr. Speaker, when you read the reports, you get a shock of your life on the conditions in those hospitals. Conditions in those hospitals, Mr. Speaker, are not encouraging and clearly you get the impression that very little work is being done to provide decent quality healthcare in our county hospitals. I have particularly read the report for Bungoma and Kakamega counties, which are counties near Vihiga County or in the same region. And it is very annoying that a big referral hospital like Kakamega, Mr. Speaker, has only one ambulance, which is a very dilapidated ambulance. If you look at the pictures that the committee has put in the report, you get shock of your life. How can such a big institution that is supposed to have quality services have that kind of an ambulance? Mr. Speaker, we have also noticed that as Senator Veronica said, the mothers sharing beds, the mothers who have delivered or are just about to deliver are sharing beds. It's very pathetic. We have issues to do with the detention of patients over unpaid bills. We have issues to do with the quality and size of the mortuary, particularly for Bungoma County Referral Hospital, Mr. Speaker. Mr. Speaker, all this is happening, and we are appropriating a lot of money to these counties. Kakamega alone gets 12 billion every year, Mr. Speaker. And they cannot prioritize the county referral hospital. Even just buying an ambulance, a good ambulance, is a problem, Mr. Speaker. Mr. Speaker, to me, when I read this report, and I've visited the 3 referral hospitals. I visited my own county, Vihiga. I have visited Kwale, Msambweni. I also visited Kilifi. I also visited Bomet. The situation is the same. Waste management is a problem in these hospitals, Mr. Speaker. Even the kitchen, Mr. Speaker, look at the kitchen in Bungoma. You can't believe it, Mr. Speaker, that kitchen is a place where they cook food that is supposed to be consumed by patients. It looks like a toilet, Mr. Speaker. Mr. Speaker, I'm very concerned because the governors in our regions are not working. The governors in our region, Western region, are not working. They are busy campaigning, Mr. Speaker. This weekend, it was one of the most sad weekend in our region. That governors would go to functions instead of telling people what they are doing to improve the quality of life of the people in the region, improve the healthcare system in the region. They were busy telling people how a certain leader is not qualified to lead this country because he has no money and because he's young. I want to tell the governors, I don't want to mention your names because you know yourself. Please work for the people. Work for the people. Give people quality health care they need. 2027 will take care of itself. Why are you fixated with the presidency and at your county level you are not delivering for the people? So, Mr. Speaker, I am talking because I have read this report and I'm very disappointed that all the big money that we are sending to Bungoma and Kakamega counties, it seems that money is not doing the work that it should do because the governors are spending little time in working for the people. They are spending most of the time doing politics. If you look at the amount of money they are using in rallies, Mr. Speaker, that money is enough to buy an ambulance for Kakamega Referral Hospital. That money is enough to fix the kitchen in Bungoma Referral Hospital. That money is enough to buy extra beds for Kakamega Referral Hospital so that the mothers don't share beds. So I am calling upon our governors, particularly Governor Baraza and Governor, my friend Lusaka, please stop campaigning, go back to your offices and work for the people of the region of Western. We are not interested in you telling us you are so rich and a particular leader is poor that he cannot do campaigns. We are interested in you telling us that you have bought an ambulance for Bungoma Referral Hospital, you have bought an ambulance for Kakamega Referral Hospital, you have improved the kitchen in Bungoma Referral Hospital, you have employed those UHC staff. Mr. Speaker, sorry for diverting a bit to talk about politics of our region, but I want to tell those people who were talking over the weekend, I want to inform them that the President Obama became the president of US after serving for only 2 years as a senator. 2 years, and he became the president because the people decided. So when you tell us someone is not capable of becoming the president simply because of age or simply because he has been a one-term senator, and you are not telling us about what you are doing to uplift the standards of living of our people, you are missing the point. Madam Speaker, when you look at the report talks about non-functional machines in the hospitals. It is sad that MRI machine is not working in Kakamega Referral Hospital. Mammogram is not working in the same hospital. And this replicates in all referral hospitals. You see beautiful machines, but those machines are not working. What is happening, Madam Speaker? You also, we also have a problem with the automation in these hospitals. A big hospital like Kakamega Hospital has no system. They are relying on reports which are manually generated. That is a hospital that should have an integrated hospital management system so that operations in those hospitals are made efficient, are accountable, and they serve the people. At least Bungoma, they have tried. They have a semblance of an HMI system, which this report has recommended that they need to overhaul it and make it better. The issue of UHC, Madam Speaker, this is a very important issue. And it's not just UHC in terms of converting those staff to permanent and pensionable, but also meeting the standards, the so-called quality health model, UHC quality health model. Most of these referral hospitals, Mr. Speaker, they have audit queries on compliance to the UHC health model, which requires that the hospitals must comply with certain criteria of matters to do with the human resource and matters to do with equipment. The same affects these hospitals that were visited by the health committee. So something has to be done. Issues to do with FIF, Mr. Speaker. If there is one thing that was done right, is the decision to come up with the FIF. But FIF is still facing challenges, Madam Speaker, because we have scenarios where, on paper, you are told that the FIF has been implemented. But practically, Madam Speaker, you find out that there are still challenges with the FIF. I am saying that because I chair the committee of CPIC, and almost every hospital have an audit query on FIF. But there is something that we can do about it as a Senate, because, you know, FIF is for level 4 and above. But for the lower hospitals in the villages, the dispensaries, they do not have FIF. So what happens in some counties is that governors decide to distribute that money to lower level health facilities so that they can sustain them. But the law does not allow that. But practically on the ground, that is what they do. What we need to do is we need to amend the FIF Act so that we can have a system of sharing of the funds from the bigger hospitals to the smaller hospitals to sustain those smaller hospitals so that they don't run into financial challenges. Madam Speaker, the issue of drugs management, it has been reported in this report for Bungoma particularly, that though they have a pharmacy which is stocked, that patients are now being referred to go and buy medicine outside of the hospital. Mr. Speaker, this is something that is affecting all referral hospitals. And something has to be done by the health committee. Because if you go to almost every referral hospitals, you see a proliferation of chemists around the referral hospitals. You see so many chemists and you wonder what is happening. It is because the medical staff are referring those patients to go and buy medicines outside. And some of those pharmacies are owned by those medical staff. This is something that the health committee needs to investigate to finer details so that we deal with any form of corruption that may be existing in the process of managing drugs in the hospitals. The issue of SHA, Madam Speaker. Madam Speaker, the delays in reimbursing SHA is a big problem and is an audit query in most of these referral hospitals because the delay affects the budgeting process, budget and control process, because they are not able to get the money in time. The delay affects the operations of the hospital. And this is something that must be worked on so that the SHA reimbursements are done in time so that end up not inconveniencing the hospital. And in some cases, it may even lead to total collapse of that particular health institution. Mr. Speaker, we have also noted in the audit report that most of these hospitals do not have hospital boards. The management boards are not there. And this is a simple thing to be done, Madam Speaker. I don't know why it is so difficult to have a hospital management board in place for many years. So this is something that, again, I'm challenging the health committee to look into, because the idea around having hospital boards is because the Office of the Auditor General is now auditing all hospitals. And the boards are accountable for all the processes in that hospital, including issues of budgeting, including issues of financial management. So it is important to have hospital boards in place, particularly in this environment where we have FIF. So the issue of having boards in place will help us in dealing with some of the challenges that have been noted in these reports. The issue of expiry of drugs, Madam Speaker, which of course links to the issue of inventory management, it links to the issue of drug management, it links to the issue of automation. It is a major problem. And it is a common audit query in all these health institutions. Something has to be done on it so that to reduce the cost incurred in expiring drugs and also the danger that is exposes to the patients in those particular hospitals. Madam Speaker, the matter of sanitation in these hospitals, I have looked at the report for Bungoma County. Look at the toilets. They are in shambolic state, Madam Speaker. And this is supposed to be a hospital where people go to be healed. You end up getting diseases in those hospitals. What is in a toilet? How much does it take to fix a toilet, Madam Speaker? So that is why we are saying, our governors, you are letting us down. And I'm happy Senator Wakoli is here listening to me, and he knows all this. I'm talking from my heart, because the Bungoma Referral Hospital serves many people. Even people from Kakamega, people from all the way Mount Elgon, people from even Rift Valley. And the same applies to Kakamega Hospital. We cannot afford to have this kind of environment in our health system, because it now becomes a center of acquiring more diseases and not healing. So, Madam Speaker, these are very important reports. I want to encourage the Health Committee that, yes, you have given us very good reports, but now there is a problem in implementation. The recommendations you give, you need to follow up to ensure that they are implemented. You came to my county, you spent the whole day, you did a very good report, but I want to tell you, the challenges that you identified still exist because there is no implementation mechanism. You need to punish people. In fact, in this report, one of the recommendations that you should have made is to punish the officers or government officials involved. Because we cannot we cannot entertain some of the things that you have noted in your report. A hospital, a big hospital that has a dilapidated ambulance, and nothing is being done about that. A big hospital that has so many mothers who have gone for delivery and they are sharing beds with their babies and with other patients, there is a problem. So, Madam Speaker, I want to encourage the Health Committee, even as they continue with their oversight engagement, they also need to put in place mechanisms to follow up on the recommendations that has been made in their own report, so that we can succeed as a country. Madam Speaker, the matter of health must be taken seriously, and when Kenyans are concerned about some matters, I think the government needs to take it very seriously. When people are concerned about reports that Ebola centers are going to be set up in this country, they must be taken very seriously. Americans have said that they do not want those patients in their country. Why do we want to allow them to come to Kenya? That is something that must be taken seriously, and it must be handled with a lot of concern and care, and not in the manner that I've heard Senator Cheregei responding to. We want answers, and answers must be satisfactory, and the health of Kenyans is more important than anything else, and more important than the health of any other citizens of our globe. Madam Speaker, I support these two reports, but I request that the Health Committee must do more on implementation follow-up on the recommendations they give. Otherwise, this is just going to be some kind of a cyclic problem, that every year we'll be doing these visits and nothing happens. And that will not be serving our people in the right manner. Thank you, Madam Speaker.
Thank you, Senator Osotsi. Senator Mudigi, have you pressed? Okay, Senator Mudigi.
Asante Bispika kwa kunipa nafasi niweze kuchangia mambo ya kamati ya afya na vile ilionelea vile kazi inafaa iwe imefanyika katika nchi yetu ya Kenya katika kaunti 47. Bispika, yangu ya kwanza ni kushukuru kamati ambaye ile ilikuwa tengeneza sheria ya 2010 ambaye ilionelea kuwe na devolution, kwa sababu ilikuwa na maono. Bispika, ilikuwa imeangalia kamati kama 10 itaweza kuwa katika kaunti zetu, na moja kamati ilipitisha ni mambo ya afya, kwa sababu kulikuwa na mambo ya national government, na ile kamati Bispika ilikuwa imeangalia vile mwananchi alikuwa anateseka, na vile wakati kama huu vile mwananchi atakuwa amekuwa katika nchi yetu ya Kenya, watu watakuwa wengi. Alikuwa na maono aitoe katika serikali kuu ailete katika serikali ya county government. Kwa hivyo Bispika, wale watu wazee na kina mama ambao walipitisha hii ni eko kwao, wale wako sahihi na wale hawako, kwa sababu walikuwa na maono. Kwa hiyo Bispika, nikiwa senator wa Embu County, mimi naunga mkono mambo ya afya ikae katika kaunti zetu kuliko kaa katika serikali kuu, kwa sababu tunajua governors ndio wenye katika kufanya kazi ile inafaa mpaka katika mwananchi pahali alipo. Kwa hivyo mimi naunga mkono mambo ya kupandirisha, kama vile senator wengine wanasema mambo ya afya itolewe katika counties ipelekwe kwa serikali kuu. Bispika, mambo ile kamati iliangalia ni mambo mengi sana ambaye haitufurahishi. Na ukiangalia katika kaunti 47, ile kamati iliona iko hiyo makosa, iko Embu, iko Meru, iko Tharaka Nithi. Kwa hivyo ile kaunti wametembea, na sira hajatembea. Unaangalia sinda ni moja, mambo ya wafanyikazi, mambo ya cha, mambo mingi inaonekana katika hii document na haikutufurahisha. Kwa hiyo kuna mambo inafaa iangaliwe. Kitu ya kwanza, Speaker, watu katika mashinani wanataka hospitali itengenezwe. Watu katika mashinani kama Embu County kuko na wodi 20. Ningeomba Speaker, kama kuna uwezo, serikali kuu na parliament iweze kuongezea pesa, ndio kila county ipate pesa ya kutosha ambaye ya kusaidia mambo ya afya. Ndio ukute hospitali imejengwa kule mashinani, na kila ward, Speaker, ukute kila ward iko na ambulance, kwa sababu njia economy, watu wengi wana pesa ya kukomboa ambulance, wengine wana pesa ya kununua dawa. Na hii serikali ya William Ruto, Speaker, imesema mambo ya SHA iende mpaka mashinani. Yes, SHA imekuwa ikifanya kazi, lakini governors wanapata pesa ya kutosha. Speaker, tunjulishe treasury inapeana pesa wakati inafaa. Kwa hiyo kuna mambo mengi sana sisi tukiwa maseneta tunafaa tunjulishe. Yeye ikawa kila wakati yote tukisimama tunasema governor, wafanyikazi, lakini serikali kuu ambayo imesimamia pesa, ambaye treasury iko hapo inapeana pesa wakati inafaa. Tunafaa tunjulishe wakati magavana wamepatia pesa wanafanya kazi kulingana na vile inafaa. Mambo ya misahara wafanyikazi, madaktari, nurses, clinical officers wanapata pesa wakati inafaa. Tunjulishe hii pesa, Speaker, kama wale wafanyikazi wametosha katika hospitali zetu. Mambo ya health, wale watu wanaangalia usafi wanapata pesa wakati wa kutosha, wametosha katika hospitali zetu. Kwa hiyo mara mingi mpaka hata sisi maseneta mpaka tuangalie vile pesa inatoka treasury na inaenda county government, vile pesa ikifika kwa county government na inaenda kwa mwananchi. Kwa hivyo tunaweza kuwa hapa tunalaumu huyu na yule mwingine. Kwa hivyo bwana Speaker, tunafaa tujifikirie mambo ya oversight. Sisi tukiwa masenators mara mingi tuko hapa tukitengeneza sheria, tukililia county ipatiwe pesa. Speaker, tunafaa tunjulishe pesa ikienda county government. Mtu wa kwanza oversight, nani wa kwanza kuangalia ile oversight? Kwa sababu tunaweza kuwa tunapeana pesa, tunapatia governor apatiana kwa wafanyikazi, yende gawa governor akombise angalie wale wafanyikazi. Mpaka sisi tuwe na hutu ya ubinadamu. Wewe uko kule mashinani, ukiwa daktari, ukiwa clinical officer, CSPs, ufanye kazi kulingana na vile unafaa. Na pia Speaker, hata kama ni hivyo, huyo mtu anapatiwa pesa mwisho wa mwezi ama apatiwe. Kwa sababu Speaker, nataka nikumbushe Senate hii, CSPs ambaye ni yeko kwa rais wa Kenya kwa hii mwaka wa 2022 alisema wao kipatiwa 5,000, 2,500 iwe ikitoka kwa county government, 2,500 iwe ikitoka kwa national government. Sile pesa imekuwa na shinda. Watu wengi wanasema watu waongezewe pesa. Kitu ya kwanza ni kujua hii pesa 5,000 inapatikana mwisho wa mwezi ndio au la, kwa sababu mara mingi kila hospitali, kila county imekuwa ikilia juu ya budget. Speaker, mambo mengi, mambo ya primary oversight tunataka kutunjulishe. MCS katika counties sote 47 iko na MCS wale wamechaguliwa na watu. Kuna nominated MCS. Pia kuna kamati ya afya kule mashinani. Pia katika county zote governor ako na uwezo na CEC na civil officer na MCS kuchagua kamati ya health. Na pia kamati ya health ile ambaye ni MCS. Kuna kamati nyingine kila hospitali inachagua, inaangalia usafi ya hospitali, utendaji wa kazi. Sile kamati ya watu kule mashinani kuonekane kama wanapatanga allowance yao njia ile nafaa, ndio kila mara iwe ikienda kuangalia utendaji wa kazi. Oversight, primary oversight pia. MCS ambaye walikuwa katika budget ya county, ambaye walikuwa wamekaa pamoja wakati wa public participation, wakuona kila hospitali na pesa ile governor amepeana upande wa afya, hiyo pesa kama imefanya kazi. Tujiulize tukiwa masenators, wale primary oversight, MCAs wanaangalia ama waangalie. Kwa hivyo kuna mambo mengi. Hata tukiwa tunalaumu governor, tunalaumu senator, tunalaumu MCA, ningeomba kama kuna uwezo, Speaker, kuonekane kama kunaweza kutengenezwa kamati, kuundwa kamati ambaye ya haraka ya Senate iweze kukaa chini iangalie kwa nini hii shinda yote iko katika county 47. Speaker, kuna mambo mengi, mambo ya clinical officers. Ndio tumewapatia pesa governors, juzi tulikuwa ngangana wapate pesa. Tuone kama walianjiri watu ambaye wako na unjuzi wa kusaidia wale wagonjwa katika kaunti zetu. Speaker, kuna mambo ya level 4, level 3, level 5. Speaker, wakati serikali ya Kenya ilisema mambo ya saa ni kitu mzuri sana, kwa sababu tumeona sisi tukiwa masenators, wakati watu wamegonjeka, wakati mama mboga amegonjeka, wakati bodaboda amepata ajali. Speaker, nataka nikumbushe Senate hii, wakati wa zamani sisi tukiwa masenators na MPs na leaders, hata ingawa Harambee hainjarundi chini, Speaker, mara mingi kila wakati yote kwa kijinji, kila kona zote ilikuwa ni mambo ya kusaidia ya Harambee. Unakuta mtu boda ameanguka chini, unakuta mguu akipelekwa hospitali, mguu inakaa mwezi mmoja, akisangiwa pesa, unakuta ile mguu imeosa. Speaker, mimi naunga mkono mambo ya saa, kwa sababu siku hizi kama kuna watu wanafaa waserekee ni mama mboga ambayo wako na ile pesa kidogo, na watu wa bonda, kwa sababu siku hizi ukiona mtu wa bonda akipata ajali, akianguka, apigwe na gari, hapo huyo mtu apate watu wa kumpeleka hospitali ama Good Samaritan, wakati amefika ile hospitali siku 3 kama injaisha, unakuta anakuwa registered kwa saa, na huyo mtu anawekwa mguu, anawekwa chuma kwa mguu, ama mahali ameteseka ama amegojeka anasaidiwa. Zamani haikuwa hivyo. Kwa hiyo ningeomba katika nchi yetu ya Kenya, kaunti 47, watu wote saa hii wajiandikishe katika hii mambo ya SHA. Mambo ya Harambee injaisha ikawa iko, lakini pia ningeomba kuweze kutengenezwa vile kuna wezekana mambo ya kanza imelete shinda Speaker katika nchi yetu ya Kenya. Siku hizi zamani kulikuwa semekana kanza ni ya watu, ni wazee na akina mama na wale wazee, lakini siku hizi Speaker, ugonjwa ya kanza iko wa kila mmoja wetu, mtoto mdogo, mtoto mkubwa. Ningeomba serikali ya Kenya weze kutafuta vile itaweza, weze mambo ya kanza iwe ni mambo ya disaster na mambo mbaya, kuweze kuwa kila county iwe kijitegemea, na ukute ugonjwa ya kanza kila kona sote itakuwa ikitipiwa bila kutoa pesa zozote. Kwa hiyo Speaker, kuna mambo mengi sana tumeona. Speaker, wakati tunaendanga nchi ya ngambo, unakuta kule mambo ya afya, hakuna kitu mtu analipa. Ukiwa mama mzee, hakuna kitu unalipa. Ningeomba tuweze kuona vile magonjwa mengi ama mtu akizeeka, watu wajiandikishe ndio tuweze kupata pesa nyingi ambayo ya kusaidia. Ndio wakati ya kina mama wazee na wanaume wazee, wakati mtu akizeeka uwe hakuna shinda, mtu atakuwa akiangaliwa kama zile hospitali ambaye tuliona Speaker katika Ujerumani, katika UK, katika Amerika, katika China, kuna sota na mambo yingine. Speaker, ningeomba kuwe na watu ambaye wenye sayansi wataweza kuangalia mambo ya Kenya, kwa sababu dawa nyingi zinatoka nchi ya ngambo. Speaker, kuonekane kama kunaweza kutengenezwa ama watu watafanya research, tuweze kupata dawa ambaye miti ile iko hapa ama vile ile vitu yatengeneza dawa. Speaker, ukute hizi ile dawa itakuwa na bei ya chini, kwa sababu watu wengi wanateseka, njia ya dawa siko juu. Kwa hiyo Speaker, mimi kiwa senator wa Embu County, ningeomba kuna mambo mengi inafaa iangaliwe, na pia ndio nchi yetu ya Kenya uweze kuendelea na njia ile inafaa. Kwa hiyo Speaker, nikimalizia, ningeomba tukae pamoja. Hata Biblia inasema njoo tusemezane, kujeni tuongee, kwa sababu mambo ya ugonjwa, mambo ya afya imeleta shinda katika nchi yetu ya Kenya, ingawa rais wa Kenya anajaribu vile kutakuwa mambo ya afya itaendelea na njia ile inafaa. Kwa hivyo, Mr. Speaker, mimi nikiwa senator wa Embu County naunga hii kamati mkono, lakini wakae chini kuonekane kama kutatengenezwa kamati nyingine ambayo itaangalia shida iko wapi, iko kwa governor, iko kwa treasury, iko kwa nani, ama ni oversight. Kwa hiyo Mr. Speaker, nikiwa senator wa Embu County naunga hii kamati mkono. Asanti, ni mimi senator wa Embu County Alexander Munyi Mundigi daktari.
Thank you, Dr. Senator Alexander Munyi Mundigi kutoka Ebola County. Senator Wakoli, Bungoma County.
Asante Mheshimiwa Spika kwa nafasi hii niweze vile vile kuchangia ripoti ambayo imewasilishwa bunge na kamati ya afya katika jumba la Senate. Mheshimiwa Spika, ni jambo la kuhuzunisha sana kwa sababu wenzangu wametaja kwa kina changamoto ambazo zinakumba kaunti yangu ya Bungoma. Mheshimiwa Spika, tunaenda kufunga ukurasa wa makadirio ya fedha za kiserikali mwaka 2025 2026. Tunapozungumza hivi Mheshimiwa Spika, wale madaktari mashinani CHPs kwa miezi 8 sasa Mheshimiwa Spika hawajalipwa. Na swali ambalo tunajiuliza Mheshimiwa Spika ni kweli kwamba watu wenye akili timamu, watu wenye utu moyoni mwao wanaweza bania fedha za madaktari mashinani shilingi 2,500 kwa mwezi kwa miezi 8? Na wao wanaendesha magari ya kifahari, wanakunywa mvinyo, chai sio ya mkandani, chai ya maziwa Mheshimiwa Spika. Hata wamewacha kutumia majani chai, wanatumia kahawa Mheshimiwa Spika. Na huku madaktari mashinani hawana viatu, hawana begi, yale mashati wanayovaa yamechoka, yamekungutwa na jua Mheshimiwa Spika. Ni jambo la muhimu sana Mheshimiwa Spika, kutoka sasa kwenda mbele, ripoti zinapokuja, wanapojibu maswali, kwa mfano katika makadirio ya bajeti lazima fedha zilitengwa. Tume ya kupambana na ufisadi isiwe tu tume kama gofu la kutazama na kuogopesha watu. Lazima EACC wajibike na iweze kutatua masuala haya. Mheshimiwa Spika, wametaja kuhusiana na maeneo ya kuweka walioaga kule Bungoma. Na jinsi tulitembea katika hospitali zingine, watu wamerundikwa kama kuni Mheshimiwa Spika. Japo wamefariki, lakini si vyema wahangaike walipo hai, ndio wanapofariki wanawekwa kama kuni zilizokaushwa Mheshimiwa Spika. Lazima waliotuacha waandaliwe mahali pazuri pa kupumzika wanapongoja siku ya kiyama Mheshimiwa Spika. Na unagundua kwamba hata wanaporundikwa hivyo katika maeneo hayo lazima watalipishwa. Sasa ni jambo la muhimu magavana wa magatuzi yetu wawe na utu. Angalau Mkenya anapopambana maishani, anapofariki, awekwe mahali pazuri akingoja Mungu wake. Jambo lingine Mheshimiwa Spika ni kwamba kuna walioajiriwa ama wafanyikazi gushi wengi sana katika sekta ya afya katika magatuzi yetu. Kule Bungoma kulikuwa na tashwishi, na hata juzi niko na takwimu na ushahidi kwamba kuna wale ambao walikuwa wameandikwa kwa awamu, kwa kibombo contract workers, ambao koti ilipitisha kwamba waandikwe. Lakini wale ambao wanasimamia uajiri wao wakajaribu kupenyeza majina wale ambao hawakuwa katika orodha, na mshahara wao ukarudishwa nyuma ili waweze kukamua ng'ombe ambaye tayari anapiga mateke. Mheshimiwa Spika, ni jambo la muhimu kamati ya afya, kamati ya hesabu za bunge tuweze kuhakikisha kwamba wafanyikazi ambao wanalipwa ni wale ambao wameajiriwa kihalali, mastakabadhi zao zipo, na kuhakikisha kwamba fedha za mnyonge wa kawaida hazipotei. Nikitamatisha Mheshimiwa Spika, kwa sababu nikiangalia klabu yangu muda umeyoyoma, ni kwamba ukiangalia miundombinu, hospitali na zahanati nyingi katika magatuzi yetu Mheshimiwa Spika bado haijakamilika. Na baadhi ya magavana wanaenda muhula wa mwisho Mheshimiwa Spika, wanatumia miradi hii kupora na kupunja pesa za mnyonge. Lazima kamati ya afya na sisi maseneta wengine tuhakikishe kwamba gavana anapoanzisha miradi akamilishe kabla hajaondoka. Mheshimiwa Spika, naomba umakinike ili Wakenya waweze kunipa umakinifu wao. Nikimalizia, Mheshimiwa Spika, tunaenda katika makadirio mapya ya bajeti, lakini tunaenda pia mfumo mpya wa siasa na kampeni. Watu wasichukue awamu hii kwa kunyooshea vidole wale ambao tuko mrengo wa serikali. Hata wale ambao wananyosha vidole, Mheshimiwa Spika, wanatamani kuingia serikali. Sioni wakipiga debe wakisema sisi liwe liwalo tutabaki upinzani. Sasa kile tunasema, japo huko upinzani na mimi niko serikali, cha muhimu tufanye kazi. Lakini usitunyoshe kidole ilhali vidole vingine viko katika uso wako. Sasa wale walio katika upinzani, naomba muendelee hivyo na Mungu watamatishie haja yenu, mubaki upinzani. Sisi tuko katika serikali, tufanye kazi, tuboreshe maisha ya Wakenya na tusonge mbele. Asante Mheshimiwa Spika.
Honorable Senators, we have now concluded the debate because I do not see any other senator interested to contribute to this motion. So I will defer this motion so that the mover can reply. So it will be listed when we next sit. And honorable senators, for the remaining orders, I will also reorganize the order paper and defer them because the movers are not there. Yours truly was having a motion number 11, but I'm the one on the seat, so I'm not able to move it. So they will all be deferred. Honorable senators, there being no other business on the order paper, the Senate stands adjourned until later today, Wednesday, 3rd June 2026 at 2:30 p.m.
Your unique vision is what makes your brand special, and Shopify gives you all the tools to do that.
Are you out of data?
When I started Chamberlain Coffee,
Muthui Solutions Hub brings you amazing data deals, tunukiwa, minutes, and SMS deals purchased with or without Okoa Jahazi. To get these deals, pay exact amount to till number 6964518. For more inquiries,